Welcome to the True Hunt, and today's maritime story is on seafarers' mental health and well-being. To discuss that, we have got a man from London, Syed Asif Altaf Chaudhary, and who has been working as the Global Wellbeing Program Coordinator in the International Transport Workers Federation, London, since 2006. Apart from that, he's also currently working with several seafarers affiliates, including National Union of Seafarers and Forward Seamen's Union in India. Apart from that, he is MD and Masters in Public Health from the University of North Carolina in USA. And we have got another guest who all the time hits hard, Gajanan Karanjikar, who is heading most of the pilots and marine association. So to start with, I'll bring in Syed Asif Altaf Chaudhary. Sir, my first question to you, as I was going through some reports which talks about calls and messages from seafarers related to the mental health increased by 37% in the last quarter. That quarter is 2023 year, April to June, across all the helplines operated by International Seafarers Welfare Assistance Network. So what is your say on that, sir?
Thank you, Gaurav, for raising this important issue around mental health and seafarers. So first of all, everybody who are with us today, I just want to remind you that the 95% of the global trading are based on the maritime sector. Like whatever we are wearing, like sometimes the fruits we are eating, sometimes the gadgets we are using are shipped by the seafarers, and we don't see them, but we see the end product of the things that we wear. So you are right. After the COVID, the number of calls that we, the ITF, and the different 24/7 counseling service are receiving from seafarers, and there are a number of reasons. First of all is that the COVID backlog has not even been cleared. Especially during the COVID time, we have seen that usually a seafarer's contract is 9 months. We have seen that some seafarers working even for 2 years. Think about someone who is out of their family and friends for 2 years. Like how difficult is for that for you and me. Like, for many of us who are with us today, who will be seeing this video, we sometimes go out for work for 1 week, 2 weeks, 3 weeks, even a month. But 9 months, then it becomes 12 months, then 14 months, and 16 months, and 2 years. That's a big time. That's a big issue that seafarers were facing and some cases still facing. And another thing we have to understand that while seafarers, especially from India, who earns relatively more than the national wage average, but there are lots of exploitation is also there. Like as you were saying, I work for the International Transport Worker Federation, umbrella body of transport trade unions, which represent 19 million transport workers, including 1 million seafarers. Last year, we recovered $50 million of back pay. The $50 million that seafarers were supposed to pay, paid by the employers for their work, overtime, and whatever, they did not pay. So our inspector all over the world recovered $50 million of back pay, which includes the Indian seafarer. So think about just two things, that I am working so hard, working out of family for a long time, and I'm not paid. And again, there are other, again, we have to understand that while you are on board ship, sometimes you're disconnected from the family. You miss your family. And you know that you can see your Facebook post, birthday party of your kids. You can see your auntie is not well, see your mother is in the hospital, but you cannot keep in touch with them. So that's a huge pressure on the seafarer. So everything together, while the connectivity is so important, at the same time, the seafarer having two lives. One is on board ship and one is a virtual reality life. So everything together, I think the pressure and the stress on the seafarer is increasing. In that case, I would give credit to the ITF and the union, the NOSI and the FSUI, and also Professor Gajanan. He is a Captain Gajanan, who is a very big advocate of a well-being program, that we are creating awareness. In the past, like 5 years back, like Captain Gajanan is a captain, during his time, nobody cared about mental health, because it's, what is mental health? Come on, So nowadays, because of all the awareness that we are creating, including Captain Gajanan and both our union, NOSI and FSUI, seafarer know that stress is bad and I have to do something. I can do something and I can get help. That's why also more people are calling us. So it's two ways. While there is a problem is there on the other side, at the same time, due to creating awareness by all of us, the people, the seafarer aware that it's not good to be stressed and there is support available. So that's the two things I would say that's the reason that number of calls are increasing.
Sir, with all respect to you, I'll bring in Captain Gajanan Karanjikar. Sir, I would like to read out that they are also experiencing abuse bullying, harassment, discrimination or violence, and this cases included discrimination on the basis of sexuality, religion as well. So how do you see this, and what has been done till date on this globally as well as
Sure.
from the
Namaskar.
Indian perspective?
Namaskar, Gaurav. Thank you very much for doing this maritime awareness thing every week. And maritime community is thankful to you for your contribution. Dr. Asif Altaf is a very good friend of mine, of course, and he himself is here today addressing this issue. First of all, you have to understand three things in this. One is what is the job of seafarer, and in what environment does he do the job? And third thing, very important, the reason of all your what you just mentioned. I don't want to repeat mentioning it because I'm a big advocate of it not to happen on. So for mere mention of it also pains me. Somebody is bullying seafarer, somebody is sexually abusing seafarer. It is a very painful activity for me as an ex-seafarer. So this is a direct result of no support system at times, a time of violence against seafarer. So three things. Working environment on board vessel is very different. It's different than any other industry. Seafarers work out of the blues. I mean, the work environment at sea cannot be compared with any other industry, period. Because that is not only harassed or, harsh or, in the weather prone and all that. It is also very demanding environment. You got only certain support. You got 25 people on board. When I used to sail, I used to have 55 people on board. Now people are 19. Some ships are operating at 60 people. So support system on board vessel for doing any emergency job or any job is very limited. So that automatically puts a pressure of, I have to do it myself. 1,000 miles off the shore, something goes wrong with the ship. That one thing is there. Second thing, the environment which is there, which is also very commercial. Ship has to reach certain time. You see Suez Canal stop. Now Suez Canal has a problem. Now Red Sea we have an issue. There's so many delays in delivery and supply chain disrupted. So the entire that pressure also is on seafarer. And the third thing which I said about support system. Earlier days there used to be a kind of body shopping of seafarers. Now shipping companies are doing much better. They have a support system ashore. There's a proper training given to seafarers. I mean, apart from mental health, their operational training, the training of the job that is required on board is being given to seafarers. So seafarers are much supported and better placed. But still these things happen because again it's the human mind. You cannot remove religion, the caste, all these discriminations from the head of people. The shipping, at least I don't know, when I was sailing for 17 years, I never knew what kind of religion or caste my crew were on board. That was not a part of any checks or balances as such there. He's a able-bodied seaman or he's a chief engineer, he's a chief officer, that's it. And that's all. He does his job. He's a professionally hired, seaman. So that was the condition then. But today, due to the social demography change and social pressures, which seafarers tend to carry on board vessel, you tend to wear those goggles and see your colleagues as well. So these things do happen, are reported in very fragmentedly at very, very small, minuscule proportion. But yes, I cannot say today we are promoting gender equality on board so much, but I cannot guarantee that the girl in her perception will not be abused on board because there are human around her. There are people. I mean, can we guarantee a girl's safety on roads? No. There's a police system. There are so many security systems are there on board ashore, but still it is happening. On board, there's nothing like this. The only colleagues. So this is going to be there, but then everybody has to look at it as in a different perspective.
Sir, I'd like to bring in Dr. Saeed. Sir, my question is in regards to the WHO, World Health Organization. When the World Health Organization highlights something, it becomes very serious for the world. As one of the report I was going through, the World Health Organization estimates that 264 million people are affected by the depression globally and states that the burden of mental disorders continue to grow with significant impacts on health and major social human rights and economic consequences in all countries. Sir, this is a journal statement, but I'm now coming towards the seafarer part. In all countries of the world, seafarers who spend many months away from home working in challenging conditions may be more vulnerable to mental health issues than the wider population. So how do you see this?
So you're right. Depression is there. And the issue is that, like, you are Captain Gazanan is from India, I'm from Bangladesh. In our part of the world, we do not talk about mental health. We think that, talking about mental health is a stigma issue. So there's a lot of silence, So it doesn't mean it is not there. So there's two issues I want to highlight here, that it is around us. We sometimes see it, we sometimes live with it, but we don't talk about it. So for us as a maritime stakeholder, both from the trade union side and Captain Gajanan, from the other maritime stakeholder side, we are trying to create the awareness that we should not be silent. We should talk about, especially, living in UK, the biggest cause of disability in UK is mental health, not cardiac disease or accident. So mental health is a real issue that affects everybody and including seafarers. As I mentioning in my opening remarks, seafarers' life is much more challenging than the people on board on shore, because out of home, missing the families and friends for 9 months is a really long time. So that keeps extra pressure on. So again, what ITF and our affiliate FSEY NUSI is doing, in fact, in that way, I was with DG Shipping, 2 months back in a session, and he made it very clear that mental health is one of the important agenda in his tenure that he will be serving. And he made an open challenge to all of us in the audience that I tell you in public that I will do it. I will take care of this. So it is good that even the custodian of the Indian maritime industry is thinking very seriously about it. But I think we need to create more awareness. We need to talk about it. It's okay not to be okay sometimes. I put it that way. So again, we need to create awareness that stress will be there, but we should recognize the sign and symptom of stress early and do something so that it does not reach out to the stage of depression and other mental health problem and even suicide. We have to understand that suicide happen on board ship. So all our effort is to create awareness.
Now I'll bring in Captain Gajanan Karanjikar. Sir, I would like to talk about Maritime India Vision 2030, which highlights some valid points that working on and acknowledges also to establish Port Welfare Committee across all ports to promote the mental well-being of seafarers. Also talks about setting up seafarers shore-based welfare centers at ports, medical support and comfort facilities to seafarers, provision of recreational facilities, reciprocate the success of Deen Dayal Port across all ports in India. So, how do you see this and how it will be fulfilling the needs of our seafarers?
Number one is that, at least today, I mean, one of the good things that COVID has done has brought this issue on the forefront. Seafarers' mental health issue was always there, was always to be taken care of. But the COVID and sudden unprecedented, long sailings and long employment gaps, these two issues brought by the COVID into the seafaring world has really brought this mental health issue. I am very thankful to Government of India under the leadership of Honorable Prime Minister Narendra Modi ji and also, Shipping Minister Sonowal ji, that they have rightly identified this as a cause or something to work on in Maritime Vision 2030. Very important document for India's progress. And if you see in GMIS also, Global Maritime India Summit, respected Director of Shipping, in his deliverables, he has mentioned one of the deliverables as the Port Welfare Committees. See, the port is the place where the ship comes to halt. It's a gateway, not only for the cargo, also it serves as an outlet to a seafarer. So where seafarer needs to go out. And for that right cause, we took up the kind of a dharna and morcha on seafarers shore leave cause in India. And I'm thankful to DG Shipping and also the Home Ministry that the shore leave has been allowed in all Indian ports now. They could be barring 1-2 incidences and the threats received by the port and stopping for shore leave. That is their prerogative. But by and large, today, Indian ports should not stop Indian seafarers at the port. Because the port is, again, as I said, is a gateway of many things. So when seafarer comes, he should be, welcomed into the port. I used to go to the remote Brazilian ports those days when I was selling escalate and third mate, second mate. We used to be welcomed wholeheartedly by the citizens of the port. This is somehow not happening these days. The times are changing. Times are becoming faster. Technology is creeping into our lives. Security is creeping into our lives. People are aware, getting more and more aware of the dangers they're involved in. But still, Port Welfare Committee and all other measures that you mentioned for seafarer welfare are very, very pertinent at this point in time. A seafarer should be able to walk in any Indian port. Deen Dayal Port has got a good Siemens club there, which has got a yoga center also, where seafarer can go and, do yoga. So I'm very thankful to this DG Shipping today that they have got something called as Sagar Yog kind of a program, which is going to be pave a long way in ensuring the strength of mental health of seafarers.
Of course, everything happens with the support and everything happens with the vision of the leadership. So I would like to take your attention towards the DG Shipping, which also talks about the continuous welfare program DGS to tie with TISS, Tata Institute of Social Sciences, and for on-call 24/7 counseling sessions and mental wellness program. So this is also an initiative which has been taken in this Vision 2030. So as you mentioned about the yoga and stuff, so I think so these are interrelated things. Could you comment on this, please?
Absolutely. Tata Institute of Social Sciences has a very big background and authority on studying of social systems, social sciences. So taking their help at this point in time is a very welcome gesture. And we should rely on the institutes like this where what has been done to the welfare of other workers. Why can't we not give a welfare scheme to seafarers? And 24/7 helplines, all good shipping companies in India have established these helplines now, and every company has employed a psychologist.
Talking about the employer's role, employers should be encouraged with guidance from the government bodies to develop clear policies and procedures which protect the mental health of their seafarers and ensure that shore-based staff have a deep understanding of how to support their colleagues. So, Dr. Asif, what would you like to comment on this, please?
I think that's the whole point around whatever service we have. Like, for example, as Captain Gajanan mentioned, already number of companies have support system, but seafarers are afraid of using the service, and also they're not aware of the service. There's two things here. One is that we have to create more awareness that it is okay not to be okay, and you reach out. That we need to tell them that there is support available. So we have to create that awareness, and we have to create that understanding that having a mental health problem is not, it's like any other disease. If you have high cholesterol, we take medicine. If you have like other issues, we take medicine. And people, and again, working at the global level, I've seen that seafarer there is a perceived fear, and sometimes there could be a real fear also that they will be blacklisted if the employer know I have mental health issue. I think which is not fair, because if you are a good seafarer, having a mental health problem should not be a barrier for you to be blacklisted. So I think this is all about creating the awareness, like the trade unions and the employers together need to create more awareness that the DG shipping controls the structure and the curriculum of the maritime school thing.
I'll bring in Captain Gajanan Karanjikar. Sir, as Dr. Asif mentioned that something can be done at the early age, and as DG shipping is also looking into the curriculum part and other stuff, so can NEP play a role in this?
Oh, yes. And before the health, I think comes with education. If you see a national education policy of India, which has been already rolled out, it is no more in discussion. It was in discussion in 2021, and it has got a huge presence of Ashtanga yoga in that. Before the health, education comes. So we are on right track with the education policy now.
Last liner from you, sir. As International Seafarers Welfare Assistance Network, ISWAN I'm talking about, is all over now, which works for the distressed seafarers, and they have got some helplines operated as well. So how this system is coordinating and how it has been an advantage for India?
See, there are many organizations who are working. ISWAN is one of them. And frankly speaking, ISWAN has done a commendable job. There's another motion called the radio, rescuing every distressed seafarers, rescuing every distressed Indian overseas, also works on the same principles. Idea is to help somebody who's in distress. I would pass it on to Dr. Asif. He has more to say.
Again, I fully agree that ISWAN is doing good service, but I must say that, as that Captain Gajanan mentioned, the Forward Seaman Union and Nusi Sahara especially, what they have done is tremendous, because ISWAN does not have a psychologist or counselor on the back of the phone. They just refer the cases. The only psychologist that we have is the Nusi Sahara, where there's a 24/7 8 Indian language trained psychologists who are providing counseling. Same with FSUI. So I'm not saying ISWAN is not doing good service. They are doing good service, but many of the time they refer the cases to ITF and this Nusi Sahara and FSUI C-Call.
End of the day, I would like to mention that with this discussion, we are on a conclusion that collaborative effort are needed to find a solution. Thank you so much, both of you. This was Captain Gajanan Karanjikar and Dr. Syed Asif Altaf Chaudhary.
Maharashtra.